Well, I decided early on that I was very interested in orthopedic surgery. In fact, it started before medical school when I started doing research in orthopedic surgery. And that's where I was exposed to surgical procedures, including hip and knee replacements, which I currently perform today. My name is T. David Tarity. I'm an orthopedic surgeon at Penn Medicine. The patients that I typically see are those that have pain and disability as it relates to their hip or knee. That can be from a variety of reasons, either from wear and tear, otherwise known as osteoarthritis. It could be from an inflammatory condition such as rheumatoid or lupus. It could be following pain and dysfunction following an injury or an infection in some rare cases. So I focus specifically on hip and knee reconstruction or hip and knee replacements. A patient can expect to have me listen to their concerns and what's affecting them to get a better understanding of what their goals are and what they hope to achieve. And also someone that's going to do an in-depth physical examination, review the x-rays or additional radiological studies, and inform them of the best treatment options to treat their condition. When a patient comes back after recovering from a hip or knee replacement and they've had a great result, it's quite rewarding for me to see that patient who was once severely disabled and in a lot of pain to be back enjoying their life, have improved relationships, quality of life, making a positive impact in their life is quite rewarding and helps me continue to strive to improve results, to continue to do research and improve our outcomes for our patients at Penn Medicine.